Chancellor Valtierra oversees the 4 Ivy Tech campuses in Gary, Valparaiso, East Chicago, and Michigan City, with a combined enrollment of 10,000 students from a 7-county area. Chancellor Valtierra serves on a variety of community boards, including the Boys and Girls Club of Northwest Indiana, the Catholic Charities of the Diocese of Gary, the Urban League of Northwest Indiana, and the Quality of Life Council. He is currently a trustee with the Higher Learning Commission and was the 2009 honoree in the Gary Steel City Hall of Fame.
We oftentimes forget about the good that happens in our community. It's much too easy to look at and reminisce and discuss and feel bad about the bad. I've met the people from Valpo Life in back and online good news service. Services like Valpo Life are going to be critical as we move forward because we need to continue to share the good news that comes across. That's what the cafes are intended to do. They help us to share the good news. They help us to share the innovative practices, the best practices that are out there in any myriad of opportunities throughout Northwest Indiana. Jonathan Nally, can I ask you to step forward, please? And I'd like to present him with the plaque commemorating the 13th event, and it reads, "An appreciation. In today's changing healthcare industry, defined by astonishing technology and highly specialized care, Porter Health Systems is not only investing in it's spelled correctly, I just couldn't see it, investing in a replacement hospital, but expanding innovative evidence-based medicine with evidence-based customer service. We celebrate Porter Health's exciting and robust renewal in Northwest Indiana, where dreams become ideas. She is presented at the Innovators Cafe Luncheon and Tour Series as a partner to Porter Health Systems on today's stage. Jonathan, congratulations and thank you.
It's amazing. It's been 3 years and 4 months since I first set foot in Porter County in 2007. When I arrived, there were some incredible things that occurred throughout this health system that truly put it on the map and gave it a mark that made it stand out from healthcare in general that you would expect in a community setting. 2 of those were how our patients were cared for in the intensive care unit, as well as how we cared for patients that were suffering from congestive heart failure. Porter Health System, 2 hospitals, Valparaiso and Portage. We're 301 total beds. We have 9 locations throughout Porter and Porter counties. We have 390 members of our medical staff representing over 50 specialties. We have $32 million annually that we provide in charity and uncompensated care. We don't have to do that. That's not a requirement. But we feel the mission that was started in Porter back in 1938, the mission that continued, the mission that was present at the sale, we needed to continue to do that. So we've actually sustained and increased our charity and compensated care throughout. That's our job. Porter County, surrounded by the red H. But you can see we receive patients from Lake County, LaPorte County, Jasper, Newton, Stark, Chicago, all over Illinois, Michigan, and we did not have a big enough map to show you that we receive patients from Iowa, Kentucky, Tennessee, Ohio, and I'm missing one in West Virginia. Our idea of innovation, listening and using data. It's not sexy, it's not flashy, there's no sequence attached to it, but it works, it's proven, and we'll continue to do that. That is our mantra within the health system. Evidence-based practice is the integration of clinical expertise, patient values, and the best research evidence into the decision-making process for patient care. That statement encompasses and packages everything that we're moving more and more towards as a health system. Any type of industry that you're in, or whatever product line that you're working towards, you can have evidence-based X in for anything that you do, and you can apply what we're going to discuss today to your industry, to your service line, to your business, to your entity. So some examples. Where congestive heart failure is a condition where fluid builds up around your heart, which does not allow your heart to work properly, and over time it continues to get worse. So the ability to catch that early, as well as continue to stay up with treatment regimens, allow you to live a longer, healthier, more quality-driven life. Dr. Michael Wee is a cardiologist on staff at Northern Indiana Cardiology Physicians. Terry Pugh is an RN that works in one of our ICUs. She has managed to put together with Dr. Wee an evidence-based practice that reduces time in the hospital for patients, improves their quality of life, and it has ranked us as top 10 nationally when it comes to looking at congestive heart failure patients throughout the country. Our intensive care unit, Dr. Mazurek, Dr. Wetzel, Dr. Mohideen, they're all intensive care physicians. We refer to them as intensivists. They're pulmonologists. They work on the lungs. And then Terry Fontenot, she's in the background. She is our Assistant Chief Nursing Officer. Terry, would you raise your hand? Intensive care units usually require one nurse either has 1 or 2 patients total, so that they can give all or half of their time solely to that patient. Your body is usually what we're going through is septic shock. Your organs are failing and you're shutting down based on some other condition that you've got. The chances of survival in an ICU are not that high because you are a sick individual. Terry and the physicians worked on evidence-based practice that allowed them to follow extremely strict guidelines and criteria of how patients, when they enter an ICU, if they follow a set protocol, it dramatically increases the chance of survival and returning them to their quality of life. To the point where Porter is now in the final processes of being included in a journal, in the New England Journal of Medicine, with hospitals such as Henry Ford in Detroit, University of Kansas Medical Center, Baylor down in Texas, Johns Hopkins in Maryland, several others throughout. And the evidence shows that when you follow these strict criteria and protocol with the physicians and the nurses, patients that come in, they leave much better, return to a quality of life, and it's just a better overall experience. So when it comes to being sick, there's no need to go to university of setting. You can actually get far superior care in Valparaiso with the Porter Health System than you would in and throughout. And it's solely based on evidence-based practices and how they adhere strictly to that criteria.